Good afternoon, everyone. Thank you so much for joining us today for the 2023 AEP Medicare Marketing Updates. My name is Chris Schneider, and I lead our Medicare business here at Centerfield Insurance. Centerfield is a leader in digital marketing services and capabilities, specializing in warm call transfer programs for licensed agents and organizations that are looking for Medicare volume. We are here to talk about today some really important updates from CMS associated with the Medicare marketing changes that are in place. So it's critical and essential that everyone recognizes and understands whatever lead generation you're using coming into this AEP needs to be updated, needs to be current, and needs to be compliant with CMS. So I'd want to welcome with me today Dwane McFerrin from Senior Market Sales, the former head of the Medicare Working Group at the National Association of Health Underwriters.
So when the draft marketing guidelines came out, these were some of the things that they wanted to avoid. They wanted to avoid those superlatives where you're describing yourself as unbiased or expert. They don't want to use the word senior, which of course the name of many agencies, it starts with senior, like Senior Market Sales where I work. So there's a lot of phrases that they want to avoid, but probably most importantly was a disclaimer that you don't represent all plans and that you would need to call Medicare. And of course, there are a lot of non-commissionable plans. It's almost impossible for an agent to say I represent every plan. Because let's say institutional plans, well, how many of you represent institutional plans as an example? But nevertheless, that is a requirement now on everything, whether it's a website, a mailer, social media, probably even on your voicemail, is to say you don't represent everybody. So that's a new requirement, those disclaimers. And what was disappointing was third-party marketing organizations, how they were defined. When the draft guidelines came out, the third-party marketing organizations, the impression was those were really lead shops, lead distributors or lead generators, and that was the target. Maybe it was mega call centers that would be the target. But when the final regulations came out in the summer, they included agents. That was a total game changer when you say an agent is now defined as a third-party marketing organization. And with that came the requirement of recorded calls. And that caught everyone by surprise. So we had calls with CMS. I had the opportunity to have a conversation with 4 people from CMS all by myself for an hour, arguing that an agent is not really a mega call center. You're solving the business problem that was really primarily caused by large call centers. And the call centers already have the ability to record calls. So why on earth would we count that as an agent? And it was interesting, CMS responded saying, well, here are examples of companies that are advertising on the television. And they pulled out Integrity, Health Markets, and those weren't just mega call centers. They had a lot of brokers or career agents involved, and CMS said they really couldn't separate the agent from these mega call centers because there were so many other players that were getting into television ads, and those television ads were causing probably twice as many consumers to shop and twice as many consumers to switch. But unfortunately, there was a 4-fold increase in the number that would complain. And so CMS indicated that if the problem subsides, just like when we remember the scope of appointment, at one point you had to have it 48 hours in advance. They eased on those rules and said, well, you just have to have it before the meeting. CMS indicated to me that they would ease on the recording requirements if the problem is addressed and the business problem doesn't continue as it was. So hopefully that's the case, but I don't see that these regulations are going away. There's not going to be a Hail Mary or last second reprieve. So recording of calls with beneficiaries is a new and expensive requirement, especially when you're retaining it for 10 years.
All right, Jeremy has a question. Insurance services, direct mail. how can sample Medicare cards be used? I'm gonna respond. And then Dwane, if you want to add anything further, to my knowledge, there's no specific restriction about using a sample Medicare card. However, all marketing has to be submitted to the carrier for review and approval along with CMS. So it's really going to be whether or not the carrier or CMS feels like it's in the consumer's best interest to see marketing like that. I don't know, Dwane, do you have anything to add there?
I think the way the lens, if you will, by the regulator will be, does this possibly confuse the senior to where they think that this is coming to them from the federal government? And so when you use that red, white, and blue card, and it looks like it's an official document, that could get denied simply because it looks like you're confusing Medicare with a lead generation activity. So, of course, you need to be clear in your document that you're not associated with the federal government. But the red, white, and blue card, I've seen a lot of those get turned down because it is too confusing for the senior. But perhaps if you file a piece and it's a smaller element, it's not the entire ad, it's more like a sample. Maybe you could get it approved, but in general, avoid the illusion that that you are actually Medicare.
It looks like, Amanda, you had another one about billboards and whether or not they're exempt from the disclaimer. Dwane typed in here, he didn't think the exemption was applicable here. It's, there's no specific call out in any of the materials I've seen from CMS that say billboards are not or are exempt from the disclaimer.
Yeah, I sure haven't seen that. It seems that if it's a website, if it's if it's a email blast or email communication, if it's something in print, they're going to want those disclosures there. So I find it hard to believe that a billboard would be excluded. I think you still have the same requirements.
Amanda had a follow-up question. You mentioned that you can't use the word senior. She's wondering where can she find that?
Yeah, I don't know if it's, you can't use the word senior, but it definitely asked to avoid use of those types of terms. I don't know how they can enforce that since senior is so evident in the product names, on the names of businesses. It's pretty common for a senior to be listed. But Amanda, give me a call and I'll have our compliance team pull that language up for you. But I think it was avoid the use of was the key phrase. And I think of all of the words there, senior would be the one that I laugh at the most, because it's like, well, what do you want us to call them? You want us to call them something else?
A Medicare beneficiary, which is like hard to put it all together, right?
But I think one of the points for CMS is about 10% of those that are on Medicare are under 65. So from a common sense standpoint, do you really want to call a 55-year-old a senior? So maybe for your own business, you need to think about it from a marketing standpoint. There are some people that you might be offending by calling them a senior.
That's true. All right, wonderful.
Last year, we started filing items with CMS or through HPMS, and that was like a last second requirement. And there were so many marketing materials that needed to be submitted, including generic pieces, that it was really stressful for everyone that was involved. And that's just going to continue. I think the big difference is if wherever you have your contract and whoever is doing the filing on your behalf, you should ask if they could be filed evergreen. So by filing evergreen, it wouldn't be an annual event. It would be something that would be approved for you to use year over year. And in my understanding, these disclaimers do not require refiling. So while you may be incorporating new language into your existing piece, from what I've learned, that it by itself is not necessary to do refiling. But if your pieces were not approved last year, Evergreen, then they would still need to be submitted again. And so you can imagine the compliance teams for wherever you're getting your contracts, they are overwhelmed. So do not wait until the last second, because it's probably going to take some time to turn it around. You should assume that the organization that you're working with is probably going to need a couple of weeks just to get that through, because they're doing it for almost every agent and agency that's out there. So quite a bit of work, but at least we have a head start this year. We started doing filings even in June. And so would encourage you, do not procrastinate on this. You may find that your piece won't get approved. And at SMS, we created a brand folder. And there are a lot of marketing materials where perhaps you have a favorite phrase or a favorite way of things being formatted. You may run out of time. So look for already pre-approved generic material that covers the topic that you have. But I think we're close to 100 assets that we have in our brand folder that are pre-approved. Would encourage you look for the pre-approved pieces first before you go out and generate a custom piece. It was really interesting, Chris. When the pandemic began, it was a big rush to sell over the phone, sell with various electronic methods. And now an agent is being told you can't do those methods unless you record it. It's almost like we'll see agents go from rushing to using electronic methods to rushing back to using face-to-face methods, because it's going to be a heavy lift to say, now I have to record every call. And even if you have the technology, you may not be comfortable saying, I'm going to record this conversation. Maybe a call center is used to that. That's just kind of customary, but an individual agent might feel uncomfortable. And so I do think that we will see more face-to-face sales by brokers this year, simply because they just don't want to comply with their new requirements. So they'll either go see the client or have the client come see you. Now there are appeals that are going on. NAHU just last week had an Operation Shout going to elected officials to say, please overturn these onerous regulations for calling. I know there was a petition, I think about 10,000 signatures that went out. And I know there's carriers that have combined together to argue as well. But when CMS says it's a final regulation, CMS can't change. So it will take some pressure. I just don't see those pressures working, at least for this AEP. I think the big question will be is enforcement. Will it be enforced? And I wouldn't want to be the agent that takes the risk saying they can't possibly enforce it. So my guess would be, and it's only a guess, that when there's a complaint by a customer, the carrier will ask for your scope. They'll ask for a statement in response, and they're probably going to ask for the recorded call if it was done over the phone. And it's not just the enrollment, it would be the persuasion conversation as well. And if you're not able to provide that, that would be probably a big black mark. Now, how big of a black mark and how many black marks do you need to have? I think there might be differences between carriers, but have you noticed that carriers haven't really published much on this topic yet? I think they're still trying to make sure that the regulations are clear, and each carrier probably has a different CMS regional office giving them guidelines. And I saw, I think it was Anthem that came out with their initial guidelines, and then they quickly pulled them back. And so I think carriers are being careful not to publish overly onerous guidelines that are not indeed consistent with the industry. But there has been a lot of crickets, if you will, in terms of carrier documentation of the requirements. But I don't expect that this will be avoided, these regulations. Anyone that tells you you don't have to do it, I think it's giving you bad advice. It looks like it's going to happen. The enforcement question is, to me, the big issue. But I think it wouldn't be hard when there's a complaint for a carrier to ask for the scope, and it wouldn't be hard, for the recorded call, and it wouldn't be hard for CMS to say, I would like to see the recorded calls, or have a copy of that recorded call, so that they can indeed audit the carrier. So I think you should assume that it's going to happen, and you don't want to be the one that doesn't have that recorded call saved. One of the things that's come up has been Zoom. Is Zoom considered a requirement to record a call or not? I've seen at least one carrier says that they consider Zoom, if it's only Zoom and not a prior call over the phone, but just Zoom, they would consider that face-to-face. But I haven't seen a lot of carriers issue any guidance on that. So that could change. But I've only seen one carrier so far that has indicated that they consider Zoom a face-to-face. But that is subject to interpretation, and you should expect anytime we get new regulations, we get conflicting direction from carriers. So you have to follow the carrier's advice. You can't interpret the CMS guidance yourself, even if you want it to be that way. You've got to really follow the lead. And if you are asking the carrier, and if the carrier rep only gives it to you verbally, that's probably not going to be a get out of jail free card. Make sure that you get the interpretation from the carrier in writing, and you want it to be signed off by the compliance team, not necessarily just a local sales rep.
So Dwane, I know you guys have spent a lot of time at Senior Market Sales contemplating all of these different changes. Do you want to talk a little bit about the things that you've looked for and some of the changes you guys are making?
Right. Well, first of all, there's a recording capability, but then the retention, 10 years, and the ease of retrieval. You could store it, but never have a way to pull it back out and provide any evidence. So we were looking for those three things. We also thought it was important that an agent should not have to change their business model. So when you look at some of the solutions out there, maybe it's on a platform that would require you to be at your desk or on a browser, and that if you're out and about, perhaps you talk to clients while you're driving to another appointment. We felt like a support solution for a mobile phone was just as important as one that would involve a landline or some browser-based system. So we really ended up solving for all three. There are tools out there where you can just integrate right into your quoting and enrollment platform. For us, it's called LA Pro, but you have a Connecture tool, you have a Sunfire tool, but having the ability to take the functionality of phone recording, if we could go back just that prior slide there. Have the ability to use APIs so that you don't have to then flip to another system. So we were looking at that. Keeping the price affordable was also something that was pretty important to us. And then the ability for an agent just to literally be able to set it up and pay on their own if they wanted to. And then, of course, we wanted to make sure that any vendor we worked with would be a good long-term partner. So those were at least some of the criteria that we went through, but we were surprised at how many solutions were actually available. So the next slide, I think we provide that. So if you're a user of Agency Block or Salesforce, maybe you should just use their phone recording capability because you already use that platform. Or you could use Vonage, Plivio, Twilio. I think that's what Centerfield uses, is the Twilio capability. Phone.com and Ring Central, those are mobile apps. So literally you have an app on your phone that you would use. So we selected Phone.com for our mobile solution, and then we negotiated with them. And so for AEP, there will not be a charge to agents that do business with SMS for Phone.com. But then there's carrier platforms like Aetna's Think Agent has phone recording capability already. But in talking to the other big carriers like Humana and And United Healthcare, I don't think they're going to have a solution for brokers this year, maybe for their career agents, but not for the brokers. Then there's other quoting platforms out there, Medicare Insurance Direct, Connecture, Sunfire. They've all offered a solution. Lead Advantage Pro, which is our platform, we're also using phone.com on that. So there are a number of different platforms. They may come at different costs. Some are out there saying at no cost, but then you're forced to use a given platform. We tried to build a system to where an agent didn't have to change. I didn't have to move my data. I didn't have to start using a new quoting and enrollment platform. I could just keep doing business the way I wanted to do business. And I think that's what makes the solution from SMS unique.
And then what's good about the changes happening this year? What is
for people that are aging into Medicare, if they don't enroll in Medicare prior to the month that they turn 65, they might go a couple of months without coverage, even though they're still within that window. So they've closed that. And so now that helps a person avoid a penalty. More likely, it helps eliminate the uninsured period. So that doesn't mean that you waited a couple of years and then you decided to enroll and that you'd avoid the late enrollment period. I'm not talking about that. But for those people that are caught maybe enrolling a little too late into Medicare, it's nice to see Medicare has simplified it. And this year, there's been so many problems with CMS employees working from home that people are trying to get onto Medicare. They're trying to call Medicare, and they're not able to get enrolled. And so CMS has also granted those people that due to the pandemic just couldn't get through and get serviced until the end of this year. They will be able to get enrolled. They just have to make a call to Medicare. Now we're dealing also with an election year. And so you just saw the Inflation Reduction Act, right, come through and announce changes for prescription drugs. We're starting in 2025. CMS will start negotiating the cost of drugs, and there will be a penalty for carriers that charge a higher premium year over year, higher than inflation, and out-of-pocket costs will be limited to $2,000. So there's changes that are coming, but the one thing I'd encourage you to do is not all of these changes are effective 1/1/2022. And so you're going to have a client that sees what's happened with the president signing this bill and thinking that everything's changed 1/1/2022. So if you have a client appreciation event or a newsletter, or if you're doing Medicare workshops, you might want to lay out the timeline on how these prescription drug changes are going to happen and really educate your clients. There's also a bipartisan bill out there for health savings accounts, which usually end, right, when people are no longer working. Wouldn't it be nice if you could continue to contribute to an HSA and really save for catastrophic events when you're in your Medicare years? So that's something that NAHU is supporting. It hasn't turned into law yet, but it is something that is actively being pursued.
All good news, really. Sounds like more change underway, right?
Yeah.